Welcome back. New reports of hair loss and suicidal thoughts have prompted federal regulators to investigate the potential side effects of popular weight loss medications. Some people taking medications like Ozempic and Wegovy have reported the side effects. The FDA says it's investigating the claims and will evaluate if any actions are needed. Now, previous research has already linked the drugs to digestive issues. The FDA advises people who use the medications to speak with their doctors if they experience any adverse side effects. And now the drug company that's launched the newest weight loss drug, Zepbound, has launched a website making it easier for people to get. Eli Lilly says the website will enable patients to get a prescription for the medication through a telehealth provider. It is the first pharmaceutical company to do so, as many other companies have struggled to keep up with demand. And with weight loss often topping the list of people's New Year's resolutions, these drugs are only expected to surge even more in popularity. Here now to talk more about these drugs is Dr. Farah, invasive cardiologist and global health advisor. Thank you so much for joining us. People are experiencing great results on these drugs. For example, Oprah, who else would you need to really be a picture for this, has talked about how it's been a game changer for her weight loss journey. But do we know anything about the long-term effects of these drugs? Are they meant to be taken for an extended period of time?
Well, for somebody who has diabetes, yes, these are initially designed for diabetic patients, so they can be taken long-term in those patients. However, when it comes to just for the purpose of weight loss, we don't know that yet. As of right now, we do not use it as a long-term treatment strategy for weight loss. We just give these to patients who are morbidly obese and they have indications for weight loss for a few months until they reach their goal weight, and then we actually wean them off of these medications.
Okay, so for weight loss, it's one thing. For diabetes, which, really was the initial use for many of these medications for diabetes patients, I'm wondering, what is the deal with insurance when it comes to that? Because let's say the drug's working, it's helping regulate, the diabetes and helping folks be able to get to a place where they're in a healthier position. Can insurers then just stop covering the cost of the medication even when a patient really still needs to be on it?
It has been an issue for many patients who are trying to be on these medications for weight loss purposes alone. Even to this day, not every insurance carrier is covering these medications. So a lot of people are actually paying out of pocket for these. And so to answer your question, yes, we do see insurances that are abruptly stopping the coverage of these medications in those in whom they initially approved. And there's a large number of people who they haven't even approved it at all. And so that is something we need to work on together between providers, physicians, patients, and the insurance companies.
And out of curiosity quickly here, how much do these drugs go for? If you're paying out of pocket, how much are we talking?
It varies from center to center, but they can be very expensive. They can run anywhere from $150 to more than $400 per dosage. Ooh. And so you can imagine these are being given once a week injection, and so the cost can really climb up.
Wow. Well, as we mentioned earlier, there have been several reports of negative side effects. Some people have experienced things like electrolyte imbalances from their weight loss, digestive issues, that they've been hospitalized. What are some of your biggest concerns with the side effects like these when you hear that?
Certainly, there are a lot of side effects, kidney being one of them. People can have kidney problems from this. GI is probably the most common symptom, people having nausea, vomiting. And of course, with abrupt weight loss, that in itself can come with certain complications, like you mentioned, dehydration, electrolyte abnormalities. So the key message here is that these are not magic drugs, and they're not meant to be taken as that. Certainly not to be taken on your own. You do need to be monitored, and it needs to be given to you by a professional who's trained to monitor you and give you in that manner.
Well, we've also seen some positive things come out of this. I think, early trials were showing that potentially these medications could help curb addictive behaviors. We saw possibly helping to treat dementia. There's a lot of excitement around that. And even in some trials, even curbing major cardiovascular events. So I was curious for your wheelhouse. Can you talk about these benefits we're seeing, and if there's anything that excites you coming out of this kind of research?
Oh, absolutely. There are many other benefits, as you mentioned, but me being a cardiologist, there's definite benefit for cardiovascular disease, particularly for those who have congestive heart failure with reduced ejection fraction. And there have been a recent study that even showed that even for those who do not have reduced ejection fraction, some of these medicines can help. So people who have heart failure, particularly, they do benefit from these, and we do put them on some of these medications.
It's incredible. We mentioned earlier Oprah saying that she's using specifically Ozempic, and as of late, she's also opened up about her journey navigating menopause. Do we know anything about the use of these weight loss drugs while experiencing perimenopause or menopause? I mean, generally speaking, how does this affect women differently depending on their age?
I really think that we need to do more research on that before we can say definitively that it has any benefit, when it comes to menopausal women, because that's a different set of hormones we're dealing with. So I would think that we need to do a lot more research on that before we can say that for sure.
Another question that we'll have to look into. Dr. Farah, thank you so much for your time and expertise on this topic today. Appreciate it.
Thank you for having me.